Let's go over the different types of IV lines. A peripheral IV is a thin flexible tube inserted into a peripheral vein. You'll commonly hear these referred to by their gauge size, and important to remember that the lower the gauge size, the bigger the catheter size. There's a special type of peripheral IV called a midline, which is a longer peripheral line that ends below the axilla. These are often placed where patients have difficult access and are inserted by a PICC nurse under ultrasound. A central venous catheter is another type of IV accessed through inserting a catheter into a large vein that ends in the superior vena cava. There are multiple types of central lines. The main difference is the type of catheter and how it's inserted. Central lines may be indicated in special circumstances, such as if a patient requires a certain medication, requires a large volume of fluids or blood, or requires prolonged IV access for treatments like chemo or IV antibiotics. An important thing to keep in mind with central lines is CLABSIs, or central line associated bloodstream infections, which is when bacteria enters the body through a central line. These are a huge topic in healthcare facilities, and it's important to follow your protocol